Why do we feel anxious and panicky? Do those who feel anxious and panicky need medical help? And how can you tell if your rising day-to-day stress is turning into something a little bit more concerning? Mental health awareness is a vital thing that needs to happen all year round, and this July is Mental Illness Awareness Month. On the same theme, of course, this suggests that the month is about creating awareness around mental wellness to help save lives and break the stigma around mental health. Hello and welcome. I'm your host, Dr. Musam Tombeni. Signing with us today is Trifosa Ntsolengwe. On Vital Signs, we will focus on anxiety and panic disorders. Coming up in the program, we'll speak to a woman who suffered from anxiety and panic attacks, and we'll speak to a clinical psychologist about the anxiety and panic disorders. We'll then speak to a senior counselor from the South African Depression and Anxiety Group about the Ivory Park and Deep Street counseling containers, the community that they serve, as well as the services that they offer. Do remember that you can be part of the show by asking the guests that we'll have on any question that you have on your mind by simply sharing the views on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Also available on your social media on Twitter at SABC Vital Signs or Facebook SABC Vital Signs. The show continues right after this ad break. Welcome back to Vital Signs. Anxiety disorders are a common mental illness in South Africa. Approximately 1 in 5 South Africans are affected each year, according to South African Depression and Anxiety Group, SADC. Now, occasional anxiety is a normal part of life, but extreme fear and worry, panic attacks, phobias, and an accelerated heart rate may be a signal that something more sinister and serious is going on. You could be suffering from panic disorder, social anxiety disorder, specific phobias, and generalized anxiety disorders. And these, of course, are issues that can have serious effects on any area of your life, resulting in you being unable to function in your day-to-day life. In serious cases, anxiety left untreated can derail your career, can destroy relationships, and may even drive a person to suicide. Vital Signs producer Zama Buthelezi spoke to Tosh Naidu from Gauteng, who wanted to raise awareness about anxiety disorders and panic attacks by sharing her story. Let's take a listen.
Tosh Naidu is one of many South Africans living with anxiety disorder, a common mental illness affecting approximately 1 in 5 South Africans each year. This is according to the South African Depression and Anxiety Group.
I had my first panic attack in August 2008, and then I was diagnosed with panic disorder. But before that, when I went to therapy and I went to a psychiatrist and got help, and when we looked back at my behavior and my actions, it was definitely symptomatic of general anxiety disorder. So I'd had general anxiety disorder for quite some time without actually knowing I had general anxiety disorder until it exploded in a panic attack.
But what was the cause of Naidu's anxiety?
I was just wired as the type of person, a very specific type of personality, where everything had to be a certain way, where I was very resistant to change, where I put a lot of pressure on myself through varsity, and then when I started in my career trying to do and be the best, and just letting external factors influence me more than finding my own peace of mind and my own peace in life.
Could Naidu's anxiety been treated without medication?
The point I reached, no, I wouldn't have, because within a very short space of time from my first panic attack, I was actually incapable of leaving my own home. I couldn't do simple things like if I showered, I had to have the door unlocked because I couldn't be locked in a space. I couldn't be by myself. I couldn't even sit by myself. I had to have someone with me all the time. I couldn't drive. I couldn't go to work. I couldn't do much, and I stopped eating as well. So where the anxiety impacts on your life in such a way that you're no longer to function normally, then I think it's very hard to do it by yourself when it gets to that point.
Fear of stigma and lack of information about anxiety disorders has seen many people suffering in silence.
I think my family did the best they could under the circumstances, because mental illness still has such a huge stigma attached to it, and it was very scary for them to have to deal with a situation that has the label of mental illness attached to it. I worked in an environment, I used to work as an advocate, that you weren't allowed to have illnesses that hindered your ability to do your job, because then it would affect your reputation. So I didn't tell anyone at work what was happening. I just disappeared for 6 months and then came back.
Is enough being done to raise awareness about anxiety disorders?
I think 11 years ago, it was a completely different environment. Where I only found SADC as a result of going online, because that's the first thing everyone does when they suffer from something. They go online to get a diagnosis or to see what it could possibly be. And health and wellness wasn't a priority for employers. And that's changing drastically. It's not so taboo today, anyway, to say you have anxiety or to say you are depressed, whereas then it was really not an option.
After the break, we'll continue our discussion and we'll speak to Sikanda Kala, a clinical psychologist, about anxiety disorders. Stay with us. Welcome back to Vital Signs. Depression, anxiety, grief, and trauma continue to increase in South Africa. In most countries across the globe, mental health is not a priority, but it's inaccessible to the country's poorest and most vulnerable. South Africa is no different. Our country urgently needs a greater investment in mental health care, not just for the wealthy that live in big cities, but for those who live in rural areas as well. Mental health care needs to be prioritized, and there really is no health without mental health. A frightening combination of physical and psychological symptoms. Anxiety and panic attacks are extremely unpleasant to experience, and they can happen to anyone. Anxiety and panic disorders can be terrifying illness, and that can cause great distress, isolation, and limits your life. For more on this, of course, we're glad to welcome our guest for today, clinical psychologist Sikanda Kala. Thank you so much for joining us, Sikanda. How are you doing today?
Very well, thank you, and good morning to you and the viewers.
So let's jump into it. Let's speak around, I think the first time in this part, we'll just talk around anxiety. A lot of people use this term quite freely, quite loosely, to say they're anxious about things, they have anxiety. But clinically and pathologically, what does this actually mean?
Yeah, I think just touching on what you drew reference to earlier on in the show, that anxiety is an adaptive and normal function for us. It prompts us to be aware of potential threats and potential things to be aware of that may be of concern. So we do have normal parameters of anxiety. But I think the big difficulty is when that changes to something that starts impairing our functioning in whatever domain of life we may find ourselves. So that's social, occupational, or academic functioning. That's when we need to be on the lookout. And usually what starts to impair functioning is when there's an increased severity or an increased persistent duration of the anxious profile. So there's a multitude of anxiety disorders that we can touch on. That's ranges from specific phobias, generalized anxiety disorder, panic disorders. There's a full myriad of clinical presentations, but all of them encompass some level of persistence and intensity that warrants clinical significance.
So what do these clinically look like? So if I, for instance, am having an anxiety disorder that hasn't been diagnosed, what are the everyday symptoms that I will feel in my life?
Yeah, so there's a multitude of symptoms that we can be on the lookout for. The classic ones are restlessness, excessive worrying, sometimes avoidance of stimuli that may cause anxiety, impairment of functioning, like I drew reference to. Anxiety can also affect what we refer to as our neurovegetative symptoms. And our neurovegetative symptoms are those daily aspects of functioning. So you can see things like disruptions in sleep, appetite, energy. So you'll find people struggle to sleep when they're quite anxious. You'll find that their appetite also drops, or sometimes they even stress eat and their appetite increases. Sometimes also the energy levels drop quite significantly, and that's because anxiety symptoms can be quite depleting and debilitating to the individual. Because more often than not, there's an internal dialogue in one's mind, which is, I'm concerned about people seeing that I'm anxious, and I'm concerned about myself being evaluated as incompetent or inadequate or abnormal. That's the thing about anxiety symptoms, is more often they also present physiologically and physically as well. So you may see what we refer to as somatic manifestations. So people will see your shaking hands, your sweaty palms, all of these particular things that feel revealing. And I think it's that fear that individuals hold on to. And you see this most prominently in panic disorder, where the individual is experiencing such a level of intensity of anxiety that it almost feels like a threat to their existence. It feels like they may die. And that anxiety is so intense that the people around you may pick up on that. And I think that's what we find very, very scary. The revelation that something internal is going wrong and people can see it.
What makes anxiety disorders difficult to diagnose? I think a lot of what you've said lives in people being able to recognize these symptoms themselves, but also people in and around you, friends, colleagues, workers and things such as that, being able to see that maybe something's not right. So why is it difficult to make a diagnosis of anxiety disorder?
I think because there's a big distinction between situational triggers versus something that's a bit more generalized and persistent. And what I mean by that is, we live in a very stressful society, particularly in South Africa, where we carry high gender-based violence rates, high trauma rates, inequality, social deprivation of many sorts, job insecurity, financial insecurity. When we're dealing with all of these stressors, it becomes very tough to delineate how much of that is an appropriate reaction to a very real stress versus how much of that is something that warrants clinical attention. And I think that's the difficulty. And to add another layer of complexity, there's a multitude of anxiety disorders. So to be able to specify which particular anxiety disorder you're dealing with, I think that makes it a bit tricky. I remember the clip that was shown earlier in the show started off with a panic disorder presentation, and as it was revealed further and further, it went into the space of generalized anxiety disorder. So it just goes to show how sometimes the diagnostic element of pinpointing exactly what one is experiencing becomes a bit tricky. And that's why we also need to rely quite heavily on the subjective reporting of the individual. And that's why an increased mindfulness and an increased self-awareness to track one's state on a daily basis, to monitor these things, note it down. How often am I having an anxiety attack? What is the intensity of it? What are the potential triggers? All of these things can start informing your treating practitioner as to what is your presentation, and then we can most appropriately diagnose and tailor a treatment plan.
Now, we've spoken to a number of disorders that are linked to anxiety disorder. So which are the most common and how do they present? How does someone who has, for instance, generalized anxiety disorder versus a panic disorder look? What are the differences?
Yeah. So the distinguishing features, you look at something like panic disorder, where the clinical presentation there is more of an immediate onset of intense anxiety that usually presents with so much intensity that the individual experiences some level of almost existential distress, where they're feeling like, am I going to survive this? What's wrong with me? What's happening with my body? Is this a heart attack? Is this something else? So it really comes with so much intensity. And the big fear and the big presentation there as well is, when will this happen again? And how far will it go? Will it result in some loss of life? That's the fear, that's the anxiety. And you usually find individuals that are experiencing this intensity will seek out help, usually with some form of like a physical need, and they'll say, hey, I need you to check if I'm having a heart attack, I need you to do this, I need you to do that. So you'll see that sort of presentation. Whereas with something like generalized anxiety disorder, it's usually a persistent a persistent anxious state that persists for 6 months or longer, and that comes with its own multitude of symptomatic profile as well. So it really requires a professional to hone into some of these things. More often than not, what I always say to patients is just track what the experience feels like. Report that experience to your treating practitioner and trust in the treating practitioner's expertise to be able to delineate exactly what you're dealing with. So that's what I'd say be on the lookout for. Also to keep in mind other things that could prompt anxiety. So track what's happening in your life, what's happening in your relationships. Track your relationship to other things as well, like substances. Are you numbing certain things as well? Are you self-medicating in ways that you're not aware of? I think sometimes we also normalize anxiety because we feel like, hey, life is stressful and life comes with these things. But the persistence and the intensity is what we always need to be on the lookout for.
So who is at more risk of acquiring or getting these panic or / anxiety disorders?
So I think there's two parts there. You know, it's not only the demographic breakdown of it, but it's also what experiences certain demographic groups experience at certain moments.
Okay.
So I'll give an example. You know, we look at the pandemic. The pandemic came with lockdown periods, which resulted in a significant drop in social interaction and a drop in a lot of stimuli that we experience on a daily experience. So for me, immediately I would think that when we go back into more workplace settings, when we start reintegrating into society, it may be quite overwhelming. There may be a sensory overload. There may be a sense of social anxiety emanating from I haven't interacted with a multitude of people for a very long period of time, and now I am in this space again. So for example, what sort of individuals would present with that? Maybe ones that were really isolated and really withdrawn in lockdown periods. When it comes to other aspects of it, maybe societies or geographical locations that experience something. And more recently, we were talking about the 1-year anniversary of the KZN and Gauteng looting. You know, and individuals that were in those spaces will maybe have associative triggers that it's that time of the year again. And that immediately starts sparking anxiety because I was in this location when there was a threat to my life or a perceived threat to my life and my safety. So I would say it needs to be assessed on a case-by-case basis, but there's certain patterns that we can see emerge in certain groups as well. When you look at the statistics, you know, one of the most commonly reported statistics is the South African Depression and Anxiety Group reports that 1 in 5 South Africans experience anxiety at some point or clinical anxiety at some point in their life. So we need to really just monitor what our presentations are in specific moments and in specific contexts.
Now, anxiety and children is something that a lot of the time people brush off, push it to the side because children don't have stress. Children only have to worry about school. But is this a real clinical problem where you find children that have clinical anxiety?
Yeah, most certainly. Most certainly. And you see that present in a multitude of ways. You know, one of the common ones among children is separation anxiety. And we see this present with different levels of intensity. A parent may be dropping off a child at school and what have you, and you can sometimes pick up on that anxiety being so intense that warrants concern from the parent. And I think it's things like that that we need to be mindful and attuned to, because with children, we're always trying to look at what is developmentally appropriate. At what particular age should we see particular presentations? But as you can hear, that requires quite a level of insight, knowledge, awareness, and mindfulness to pick up on that. So I think the big advice that I'd give to parents is just doing more and more research, being more and more well-informed on what is developmentally appropriate. And sometimes teachers can also be very helpful at this as well, to give guidance and say, hey, I'm surrounded by children on a daily basis, and that allows for some level of appraising what is a normal baseline. And when I'm picking up on something of concern, I can raise that to a parent, and a parent can then take that seriously and investigate further. It doesn't necessarily mean that it's something that is diagnostically of concern or what have you, but it does mean it's potentially a blind spot that has been missed and something that we can investigate further. And once we investigate, we can then take it from there.
Has social media caused an increase in anxiety? I mean, I'm sure there are studies that are currently ongoing with respect to this, but are these common complaints that the everyday man that comes to see you complains about, you know, issues of social media, of pressures and things such as that?
I think what social media has done is it has created quite a landscape of comparative assessment.
Okay.
So when we then look at things like how normal am I, or is this a normal experience, it becomes very difficult to gauge, because as we know, sometimes on social media, there can be an over accentuation of what is positive and what is aspects of only great aspects of life, rather than indications of aspects that are more frowned upon or more difficult to deal with and what have you. So it really distorts reality on some level. And we're talking about social media in the sense of consumption, but also sometimes in producing content on social media, people feel like they're putting themselves out there. They're being vulnerable with what they're putting forward. And anytime you find yourself in an evaluative space, you then feel anxious on, am I going to be evaluated in a good light? And that sparks some form of anxiety. Also, interestingly enough, with all of the virtual work that we've been doing, we sometimes, we've been hearing presentations of things like Zoom dysmorphia and what have you, where individuals may experience how they look on camera as different to how they look in real life, which then can create insecurities to how I maybe look in real life or how I present in real life, which then adds another layer of complexity to it. So I think we're living in very interesting times, very modern challenges that we're facing. And I think we just need to be on the lookout for how that is affecting us. And usually the best approach for this is self-check-ins and making sure that you are monitoring your anxiety levels, you're monitoring your insecurity levels, and just making sure that you're centered and aligned to who you've always been and how you want to conduct yourself.
Well, look, we're going to continue the discussion. Of course, namhlanje sikhuluma nge-anxiety nama-panic attacks. Mangabe wena umuntu unokozizwa sometimes ukuthi yazi awukho right, usizwa ngathi u-anxious, usizwa ngathi inhliziyo ishaya kakhulu uma ucabanga ngama-situations akhona emsebenzini, akhona esikolweni nento ezinjalo, ubona ngathi hayi awuzizwa u-right. Well, namhlanje sikhuluma ngaloko, and mangabe wena ke umuntu ofuna ukuthola ama-answers kuyo lonke lento, noma ke ufuna ke ukubuza umbuzo to usekhanda khala, kulula ke ungasipha i-phone call 011 7145877 or 011 7145861. Sifuna ukuzwa from wena, ningayi indawo siya ku-app break, masibuya so continue ngale conversation. Rally ahumela hape wona mona ho Vital Signs ke na Dr. Musa Mthomene ka jeng re bua ka anxiety le di-panic attacks. Haebe wena he o mo hae o ikutlwa nkare he o motho a jwala a ikutlwa nkare moya ha o right o worry ka ntho tse ngata, o na le anxiety ka ntho tse ngata, le moya ha o nahana ntho tsa mosebetsing le sekolong o ikutlwa nkare ha o so kgona ho hema, pelo e shapa ka haholo, pelo e shapa ka pele ntho tse jwalo. Re bua le wena ka jeno hobane re bua ka anxiety le di-panic attacks. Now, according to research, most people feel anxious about the possibility of having another panic attack when they go out. Of course, these situations need to then be avoided in which they believe that these attacks are likely to occur. This is where the issue comes in, and of course, this is where you start to worry about having another attack, and of course, you start to avoid it. Now, this results, of course, in further anxiety and exacerbates the problem, leading to possible diagnosis of panic disorder. We continue our discussion with clinical psychologist Sikanda Kala. So, Sikanda, we continue our discussion. A little bit earlier on, you've alluded to this idea of panic attacks. What description or definition do we give to panic attacks?
So again, just drawing reference to the fact that it's a sudden onset, intense anxiety state that comes with an immense amount of fear. Usually it could be a fear of dying because of the intensity of it. There's a strong heart palpitations, increased heart rate presentation. There's the fear of where does this actually go? So it's more like a preemptive fear that presents sweaty palms, shaking hands, tremors, all of these particular presentations that emerge. And I think, like you rightfully pointed out, one of the big issues there is the risk to self, but then also the big fear about what if this happens again? Because often it's very, very debilitating in a social setting, and it impairs one's functioning in that setting. So that comes with some level of exposure where the individual feels like people around me can see that I'm in a debilitated state. And that fear of embarrassment and that shame and what have you that revolves around it is one of the big aspects of it. And like you rightfully pointed out, that results in quite a strong picture of avoidance. And the thing about avoiding anxious states is you then never get to extinguish those fears. You never get to normalize it and say, hey, I experienced this anxiety state and I never died. It never culminated in what my biggest fear was in that moment. And sometimes it can happen in a car or somewhere else, and there can be an avoidance of that particular space. So you can imagine if one avoids getting in a car, that can impair their functioning. They may struggle to get to work. They may struggle to attend social functions. So it impairs their social life. It impairs their occupational life. And if they never put themselves in the car and realize that they're not experiencing another panic attack, they'll always sit with that fear of, if I ever get into a car again, I'll experience a panic attack. And that thing just perpetuates the avoidance.
We've got Kenneth from Limpopo on the line. Kenneth, good day.
Good day, Doctor. How are you doing today?
Good, Papa.
Right. No, man, I'm actually listening to your program. It actually felt very much personal and direct, so it hit me straight to the heart. So I thought maybe let me give it a shot and try to spare my experience with you. But perhaps I could get an advice or two.
Okay.
I haven't been diagnosed with panic disorder or anxiety or whatsoever. What I was being diagnosed of, it was acute coronary syndrome, of which how it was happening is I could feel like I'm losing my mind a little bit, and then my heart would start racing, hitting me hard. I could feel the pain, and however, it used to last for just a couple of seconds, maybe between 30 seconds to an hour. But my challenge is when I'm driving, then everything breaks loose because I can't take control of anything. So I happen to be alone, staying or maybe walking or executing any task, then I was going to collapse. So then I thought maybe it's probably heart attack. And then only to find that when I go for a scan, it shows that my heart is actually the artery, they're opening and closing properly, and then they say no, it's something else. Then it disappeared for a while. I didn't take proper treatment to it. However, now I'm actually experiencing it quite often, like maybe every second day or so. And then just after that, I think I'm having a combination of panic attack disorders, as well as this, what do we call it, sleeping paralysis kind of a thing, whereby when it hits me whilst I'm sleeping, then I'm struggling to wake up. I can't even tell. I can't even feel the finger or something. Then I result on screaming.
Okay. Thank you very much, Kenneth.
Keep imagining scary things over and over again.
Yeah. All right, Kenneth, we'll speak to Sikanda here, and he'll sort of give you sort of the advice. But I think we'll open up a bigger discussion because you've actually mentioned quite a lot of things that, you had ACS, which is acute coronary syndromes, and also how that may present in itself with respect to panic attacks. So thank you for your call, okay? Lovely. So, Sikanda, the idea of panic attacks versus having actual physical heart problems or breathing problems and things such as that. And of course, I think the second part we can address in terms of Kenneth is this idea of having undiagnosed mental illnesses or concurrent problems.
Yeah, I think that really raises a pertinent issue, comorbid presentations. And I think that adds a layer of complexity because an individual, especially if it's something physiologically presenting or some physical indication of that as well, usually then it almost feels like it justifies the worry, it justifies the concern. And it becomes very difficult to delineate how much of this is an anxiety issue and how much of that is something that warrants immediate emergency physical intervention. And I think that really creates a horrifying situation where the individual feels like they're in this perpetual state of fear and anxiety revolving around the situation. So it's very tricky, and I think that's where a multidisciplinary team comes into play to say, hey, for this particular presentation, let's take this treatment approach and let's monitor it quite closely, and providing the reassurance that one needs to say, based on this clinical profile and this clinical presentation, we are not worried about these particular things. And then another team member also says, based on this clinical presentation and these indications, we're not too concerned about some of these things. And I think to reassure the patient of that becomes so important. And I think it's a process of containment. It's a process of supportive systems coming into play as well, to say the subjective lived experience and the feeling in that moment versus what we are objectively finding. Let's find a way to negotiate the two, in which we don't invalidate your experience, but we also give guidance and expertise-based information on how to best maneuver through some of these presentations.
So how does Kenneth get help with respect to the anxiety that he describes, the inability to sleep at night, and of course, all of those states that he suffers from? How do they move on from this point to getting treatment?
So I think there's many options that we have, but also at the same time, we need to factor in limited accessibility and availability at certain points. So it's always going to be context specific. I think you drew reference to it earlier in the show, that what may find in a metropolitan area may be very different from a rural situation or rural context. And I think it's important to identify what systems and infrastructure are available for you. Obviously, there can be public health systems where one could go to their nearest clinic or hospital and try and get intervention there. Other times it may be NGOs like South African Depression and Anxiety Group, reaching out to them, and if they can't assist, they can definitely point you in the right direction. For certain individuals, they could seek assistance in the private healthcare system. But I think we all have a role to play here in saying that there's a lot that needs to be done in reinforcing our healthcare infrastructure, but also a lot that needs to be done from a community perspective, in which educating community leaders, making sure that they can also point individuals in the right direction, and also realizing that it begins at home as well, that we may not have the expertise or the qualifications at home, but what we do have is the ability to connect on a human level and say, I see this is causing a lot of distress. I'm here to help. I'm here to support. I'm here to listen. And sometimes that can go a very long way. So I would say all of us at all levels of society have a role to play in trying to assist.
So you've touched on treatment, or getting the people that have anxiety and panic disorders better, decreasing avoidances, and of course, trying to get them to a state in which function has gone back to normal and there's no longer any impairment. So what are the treatment options available to someone that has anxiety disorder or panic disorders?
So there's psychotherapeutic treatment options available, things like cognitive behavioral therapy, which employs cognitive techniques so more thought-related techniques, challenging negative automatic thoughts, challenging cognitive distortions, things like that. Also behavioral modifications that can come into play, things like what we refer to as exposure therapy and systematic desensitization. So putting people into context slowly over time, making sure that if one has a fear of getting into a car again, you start off by showing them a photo of a car, a video of a car, see how they tolerate that, then looking at an actual car, see how long they can tolerate that, then sitting in a stationary vehicle, then driving around the block, then driving on the highway, just building that resilience more and more over time. There's modalities like that. And then there's obviously pharmacological intervention as well. So we could explore medication options, whether that's something like anxiolytics, and there's different classes of that as well. I think that's something that needs to be discussed with the prescribing practitioner, and to say, hey, these are my concerns about side effects. These are my concerns about dependence or potential withdrawal symptoms if I take something for too long. These are all valid concerns, but it's concerns that can be raised with your treating practitioner and can also then be reassured on what is the best approach and best way forward. And then, like I said, just general community-based and familial-based and friendship-based and partner-based support systems as well, that we can rely on, and making sure that we integrate those into our daily routine, which also speaks to just maintaining daily routine and daily functioning, tracking one's sleep, one's appetite, one's energy, and one's social functioning. All of these things go a long way.
So before we let you go, there is a tweet from Oka here. Oka basically wants to address something that we didn't really focus on today, this idea of phobia, saying morning vital signs, interesting topic. I was scared of heights when I was younger, but not that much. Now I'm 49 years old and I've recently experienced a panic if I'm about to go towards a bridge or anything that is high in such a way that I feel like I could collapse. What is happening and why am I being triggered? So very quickly, if you could take us through just this idea of phobias and how this person can get better.
Yeah, phobias are a very, very tricky one, because there's an aspect of there which it feels like a disproportionate fear or irrational fear relative to the actual threat or the actual concern at play. And this makes it very difficult from a support system perspective, because a lot of individuals around you can be like, hey, just snap out of it. Just grow up. Why are you making this such a big deal? And they can invalidate the lived experience quite significantly. And I think it's important for us to all integrate some level of empathy and compassion to say, hey, I can clearly see this individual is in distress, and this is a very real moment for this individual. Let me pitch up and be present to understand that. With specific phobias, we need to identify where the phobia emanates from, what are the triggers, is there something historically that prompted the initial presentation of that. So it's quite a layered one, and we know that specific phobias present with a multitude of phobias. So I think it will be very phobia specific. It will be very presentation specific. And for me, the biggest thing I would say is to normalize, validate, bring that individual into a space where they feel comfortable to share and disclose their experience, so that they don't feel silly, they don't feel ashamed, they don't feel embarrassed, and that we slowly but surely start working towards it. Because if you embarrass the individual or shame them into it, more likely they're going to suffer in silence. And we know with mental health, there's a very strong common occurrence in society of suffering in silence.
Well, thank you so much for joining us today and really addressing these big issues of what we're discussing today. That was Sikanda Kala, clinical psychologist, speaking about anxiety and panic disorders. After the break, we'll speak to Noni Maseko, a senior counselor from the South African Depression and Anxiety Group, about the Ivory Park and Diepsloot counseling containers, the community they serve, as well as the services that they offer. Stay with us. Welcome back to Vital Signs. The South African Depression and Anxiety Group said that together with Netcare Lifestyle Trust are making a difference. Recently, they launched the Ivory Park and Diepsloot counseling containers, providing help and guidance to people who, before the center, had nowhere to run to. Now, many of the residents need mental health care and, of course, are in continual need because they are continually victims of crime, poverty, and often uncaring, inaccessible systems. Whether it's depression, rape, domestic violence, substance abuse, or problems at school, the people in these areas have now got someone that they can speak to. Let's welcome Noni Maseko, the senior counselor and coordinator for the district container in Ivory Park, about what this actually means, what the counseling containers are, and of course the communities they serve and the services that are offered. Good day. Thank you so much for joining us, Noni.
Good morning, Musa, and good morning to the viewers.
Lovely. So let's talk about these containers. I think, a lot of the time we'll speak to the idea that mental health and people being mentally fit is something that's generally reserved for people that can afford to have a psychologist and a psychiatrist and a counselor and all these sort of niceties that we've normalized for rich people, but never for poor people. So why the idea to put these containers to assist in Ivory Park and Diepsloot?
I will start with the one in Diepsloot. The container in Diepsloot was put in 2011.
Okay.
I started working at the container in 2014. And Diepsloot has 2 clinics. Both clinics don't have mental health services. So the community in Diepsloot, they rely on the SADC container. And the one in Ivory Park was actually initiated in 2018, but we managed to get a sponsor, which is Life, which is Netcare, in 2020. So in the middle of COVID, we were actually busy doing the runaround, going this way and that way, making sure that we get space and we get the container. So eventually we did get the container with the help of Netcare. The container was launched in 2021 in October. So this is where we are.
So, I mean, with the communities that you've mentioned, a large number of people live in these communities. I mean, I think you could count into the millions, perhaps, of how many people live in these communities that desire and need these services. So what are the big problems that are generally highlighted from the people that visit the centers?
Okay, we can start with the most general, which affects the whole whole of South Africa, like your poverty, unemployment, substance abuse, and GBV. But we get deeper in your worse mental health illnesses like your bipolar, schizophrenia, and even borderline split personality. So we're struggling with those in our area. Yes.
Now, with these problems being highlighted, I think let's also address what services are offered by the containers from SADC.
I didn't get your question, Musa.
What services are offered in the containers?
Oh, okay. We do one-on-one, and we do a lot of referral. We refer to Tembisa Hospital, Helen Joseph, but we rely mostly on the corporate clinic, which is closer to Goodstood, and Randburg Clinic. So when a client goes to Vetkopen Clinic, we even assist with transport to go, and Vetkopen assists with transport to come back. So that makes that's easy for the client to even want to consult, because there is someone that is footing for the transport.
Who comes to the containers? I think, having a container is nice when, your community only has 2 clinics, there's no social worker, for instance, and there are no mental health facilities that you can use, and you can go to the container. But who are the people that are seen frequently, and what are the big issues that they come to you about?
Mostly we see, I will categorize the age. I would say teenagers. Teenagers are struggling mostly with psychosis induced by substance abuse, and mostly family problems, which leads to attempted suicide. And you will get to 20 to 25, those that are like struggling in relationships and even being dumped, and GBV. So we have a high number of cases between 20 and 25 in GBV. And you'll get now your matured people, your 40s, that are struggling with employment, poverty, and having so many children surviving on the SASSA grant, And you will get your 50 and up, and even the granny to 87, those struggling with grandchildren that they're staying with, they're supporting, but stealing from them. So it's a lot. And we even have grannies that are struggling with dementia and Alzheimer.
Are these services free, and how do I get the services? Is it a walk-in center? Do I only need to come in when I have a referral letter from somewhere else? How do I get access to these services?
Our services are free. You can come in with a referral letter. You can walk in. You can call with numbers specifically for Goodstood, where you can call and book an appointment. But we happy to get walk-ins whereby we get a lot of work.
What do your numbers currently look like with respect to the number of people that you're seeing at the facility? I mean, the way it's been described and the way that it is, when someone says container, you don't think it's, it's not a big mansion where there are tons of services and lots of counselors and things such as that. So how many people do you actually serve and have you seen?
Per day, we see between 5 and 10, because we 2 counselors. One will see 5, I will see 4, I will see 6, but we having a large number of clients, especially from June until today. I don't know why that's happening. Was it because we were not working during COVID, so people are just coming in,
And in terms of future plans to open up similar type projects for other communities that are underserved with respect to mental health care, other communities that exist, are there plans to put up more containers?
Yes, there are definitely plans. Diepsloot falls under Region A, so it's Ivory Park. So we also have Lion Park, which is very close to Diepsloot, whereby we have been working there. But now seeing that there is a need for us to put a container there, we're also stretching our arms to other areas like in Sawawa and Kaya Sense, which does not really fall under Region A. So we will be visiting the areas also tomorrow. We're doing like a community awareness and then seeing where we can exactly put the containers. Because in Sawawa, it's worse because they don't even have a community clinic. They rely on a mobile clinic from Vetkopen Clinic.
And in terms of assisting those that can't get to those clinics, that live outside of the regions that you've specified, how does one get in contact with SADC to get the help that they may need?
Okay, I am going to give the SADC office number, the toll-free number, which is easy for everyone, does not need airtime. I am going to give 0800 456 789. 0800 456 789. I will give the second one, 0800 21 22 23. And you can also find SADC on Facebook. You can mention if you're staying around Diepsloot, they will definitely send me your details so that we can contact you.
Okay, lovely.
And we can appoint you.
Thank you so much, Noni, for coming out and really highlighting the importance of these containers and what they actually do. I think it's so important that, you know, communities are served, not just awaiting government help, but that the private sector does come in and look out to assist, especially with conditions such as what we've highlighted today, panic and anxiety disorders, such important topics that we need to look at and, of course, address on a daily. Things that a lot of people don't generally talk about, but really manifest themselves in a number of ways. Thank you so much for joining us, and we hope that today we've really put that light out there, made you realize that these are actual things and that you can actually go out and assist people that have these disorders and maybe help yourself, that there are ways in which you could, you know, do things to prevent and, of course, get treatment for these disorders. And that is the end of the show. This was Vital Signs. I'm Dr. Mosamtombeni. We'll catch you again next week.